कहाँ दिख रहा है almost. Namaskar. Hello and good afternoon to all watching, all the viewers, all the listeners. Today I'm going to take a very common topic and which is prevailing on the all the households, that is low back pain. But not exactly low back pain, but I am going to take the topic that is low back care, which is very important. And I've summarized my slides, all the presentation in a such a way so that every common man of any field can understand the things. Basically, we are going to discuss or present the care for our low back. And if there is the care, you can avoid the low back pain. So here now we start up with the presentation. I, Dr. Vivek Chauhan, Professor and HOD School of Physiotherapy of Vilashi University, got an opportunity, and thanks to NDLI Club and my management of Abhilashi University to oblige me with this presentation. And here we start now. See, now the presentation is all about low back care. And when I'm talking about low back care, there are a lot of personal factors which are common for the low back pain. Now, considering the age, previously it was like the specific age group was there, but now it is confined to any age group. And we'll in further slides, we'll see that it is all because of drastic lifestyle changes. It is now very common among the young adults also, and obviously the aged people. Considering the genders, both the males and females, they are equally affected. Now there is no more any sex ratio left, gender ratio left. Both the genders, they are equally affected. Now talking about anthropometry, there is no evidence based on the body size or shape. If he can be a sportsman, he can be a gymmer, he can be a fitness trainer also, he can experience the low back pain. There is evidence for the physical fitness and conditioning. The people, those who are physically fit and conditioning their body regularly, they are away from the low back pain and they are really taking care of their low back ache. The main thing throughout the presentation, what I'll be discussing with you all is the lumbar mobility and the strength. Please remain focused on these two things because we are going to discuss it again and again. The mobility of our lumbar region, that is the lower back. We call it, in the next slide, I'll tell you. See, the common back disorders which are affecting the low back is general joint stiffness. This we are talking about the spinal joints, acute strains and sprains. That is equally both the ligaments and the muscles they are affected. I'm talking about spinal column, the muscle guarding or spasm, which we always say कि भी कमर अकड़ गई है. The disc bulge, which you can see in the slide also, the bulging of the disc or the herniation, and the degenerative disc diseases that is related to common trauma disorders and the osteoarthritis. We are all aware of this term osteoarthritis. This is common aging degenerative disorder which starts immediately with the evidence-based articles and journals are there after age of 30. As if we talk about the disc comprises of a lot of water and proteoglycans, and they have nucleus pulposus and annular fibrous which gets degenerated with the growing age, and with the further drastic lifestyle you can experience the osteoarthritis of the spine. See, I have covered the spine and this topic today, and I'm not going to details, and this is not an anatomy class going on for any one of you. Basically, we are just focusing on the bones, the joints, discs, the muscles, and the ligaments and nerves confining to our spinal column. And it can be from cervical, thoracic, and the lumbar region. See, please do focus on this slide and this spinal column. This is both the AP lateral view. In the lateral view, the first view is the lateral view, where you can see the cervical region, thoracic, lumbar region, sacrum, and the coccyx. Fine. The why I am showing you this slide. See, if I talk to a common man also, I hope so. My presentation is watched by the non-medical people also. This is the correct image of the spine. This is the correct curves of the spine. If you see the cervical region and you see the lumbar region, these are the lordotic curves which are normal. And the thoracic, this is a kyphotic curve which has to be in this shape only, a S-shaped spine, or you can say a sigmoid shaped curve, which has to be there if you want to avoid any type of low back pain. And considering the this posterior view, you can see the back. And whenever the cases come to us or any orthopedicians, what we'll see is there is loss of this curve. The cervical curve, it is straightened. The kyphotic curve, it has aggravated. And the lumbar curve, again, it becomes a flat, leading to the flat back also. And this is the main thing. When the curvature, when there is degeneration of the disc, when there is loss of the fluid, poor lifestyle, we lose this curve. And mind it, if I am showing you this slide, you just keep an image that this is the spine we need to maintain. Now, this is the household problem daily. Now, if you see, if you focus, and if you're really watching, and if you really want to know, the first image, what you're seeing is the normal disc, which I'm showing you in the getting degenerated, and what will happen, both the vertebrae, they'll come close to each other, and they will lead to the compression of the nerve because of the root canal. The canal which you are seeing adjacent to the disc, it becomes congested. The space becomes narrow, which leads to the compression to the nerve. More prominently, if we talk, if you see the third vertebra, that is bulging of the disc. Now, this is the complication where the patient starts complaining of severe low back pain. Whenever I am sitting for a long time, standing for a long time, kitchen mein, the homemakers, the house ladies, working in the kitchen, they start experiencing pain, and the टांगों में दर्द जाता है, पैरों में दर्द जाता है. It is this disc now which is coming into the canal, और ये वो canals हैं जहां से nerves हमारी टांगों को जाती हैं, the sciatic nerves, the nerves which are moving downwards towards the lower leg. Now, उससे भी ज्यादा अगर इसको देखा जाए, there is herniation of the disc. Now, this is the blue part which you are seeing around the canal. It is the nucleus material जो मैं बार बार कह रहा था, जो इस डिस्क के अंदर we have water content, we have proteoglycans, we have glycosaminoglycans. These, they imbibe and they act as a cushion for our spine. Now, what happens is, with the aging, again, now this nuclear material, excessive tensile forces, excessive compressive forces, they are there. So होता क्या है कि जब हम ये compression बढ़ जाता है, this nuclear material, it oozes out posterior-laterally, or there can be central protrusion also, which is a severe condition again. Now, what will happen? There will be severe compression of the nerve, continuous radiculopathy, radiating pain on the calf region, thigh, back of thigh, your lower leg, your ankle, foot, thumb. They will be all, and it can lead to अगर जिसे हम कहते हैं कि भी कई हमारे पास पेशेंट्स आते हैं कि सुन पड़ गई है टांग, कुछ महसूस नहीं हो रहा. इट इज बिकॉज ऑफ दिस severe compression. Now, coming down, there is thinning of the disc. Again, this is a problem again. Fine. Then there is disc degeneration with the osteophyte formation. See the outer growths, if you compare it with the first vertebra and you see the last vertebra, there is now outer growths coming out both the sides. These two outer growths, it is known as osteophyte. एक चुन जैसी जो आपको दिख रही है outgrowth, this bony outgrowth is known as osteophyte. This is again further common reason for the compression of the nerve. And it is not only the nerve. If you talk about, because starting from the degenerated disc, bulging, herniating, and thinning, the ligaments around this spinal column, the muscles, the fascia, they are also under severe stress. They are continuously under the spasm, leading to the pain and restriction of the lot of lifestyle activities, normal day-to-day activities. See, this is what I was talking about, the sciatica, which is household name. अगर घर में चार लोग हैं तो a one person definitely may be suffering from sciatica. See, it is the pain. Again, जितना भी आपने देखा disc bulge हो रहा था, what is happening? It is compressing the nerve. If you see, the slide clearly shows the L4 and L5 nerve. This get compressed and the pain radiates down. When you stand up more than 20 minutes and you go for the continuous sitting and keep mobile for the long works and stretch regularly, there will be definitely pains going on. And to avoid this condition, definitely you should consult a physiotherapist. Physiotherapist is a person who really works on the, because of the sciatica, what is happening is there is definitely defect or the dermatomes and the myotomes. If I talk, the muscles and the joint area regions, they get affected. So the best person or the best specialist to consult is physiotherapist for this condition. Now, if you talk about the leading causes of back problems, since our topic today is back care, first we need to understand the back problems. See, if we talk about, the first point says poor body mechanics. See, mechanics is a term which is denoted in the medically, we denote for motion. When the body is not in a proper motion, ideally, the you are not sitting correctly, the standing posture is incorrect, the working posture is incorrect, or your occupationally, wherever your office chair is there, table is there, it is incorrect. And with that thing only, the body is in continuous motion. In the incorrect posture, it will definitely lead to back pain. Stressful living and work habits. Stress, common reason for all the pains, but with the stress, the back pain, the back muscles, they undergo spasm, and the working habits, continuous sitting for long hours on the desktop, laptop, continuous watching. Your nowadays the youth, why I took the 20 year and above, they are on the very important thing, WhatsApp status, social media, Insta. खाना मिले ना मिले, but एक फोटो रोज अपडेट होना चाहिए, regular usage of mobile, and that also in inappropriate posture leading to low back pain. Now, post COVID, this is my personal experience and definitely you all will agree also. पोस्ट कोविड में तो सबने बहुत एक्सरसाइजेस किया, दे ऑल वर्कड आउट, यूट्यूब से बहुत सारे वीडियोस डाउनलोड हुए, कईयों ने बनाए. बट व्हाट अगेन, वी आर बैक टू लाइफ अगेन, वी आर लूजिंग द फ्लेक्सिबिलिटी. नो वन हियर is focusing on flexibility. And the common question if I ask to my patients or all the normal people, time nahi hai. I don't know what they do for 24 hours, but let me tell you, even the people, those who are listening and going to listen in future, flexibility is very important. And the loss of strength, again, हमारा लाइफस्टाइल ऐसा हो गया है, either we are working out a lot, and if you are working out a lot, we are just working on those muscles which are not just, those muscles are just for show off. If I talk about gym people and all, again, but our main focus is not the power. Our main focus is strength. And this is a qualified physiotherapist, if you talk about and if you work with, will definitely tell you the role of flexibility and strength in your body along with the muscles and the joints. Minded, जो मैंने शुरू में कहा, you have to keep the image of that S-shaped spine in your mind, because of this flexibility and strength, these are the two basic factors maintaining your body mechanics. You can achieve that S-shaped spine. Another common causes, which is definitely, we have apartment culture, we have a lot of workstations, malls, and we are आजकल लोग मंदिर भी बहुत जा रहे हैं. So definitely when you are moving upstairs and downstairs, again, either we are moving upstairs, we always flex the spine. Flex in the sense we always bend forward. Fine. We when we get tired, we start pulling up with the railing. Start pulling up with the stairs. Again, that forward bend position puts stress on the spine. Okay, so we need to take care. If you are getting fatigued, if you are getting energy loss, instead of bending your spine, pulling it up, better take a rest, gather some energy, take some fluids, then move upstairs and downstairs. And while moving downstairs, what is happening is, if the stairs are too much descending downwards, what you all do is we start extending the spine. हम कमर को पीछे की तरफ करते हैं, जिससे अगेन व्हेन वी गेट टायर्ड, अगेन बार बार कमर के पीछे हाथ लगाते हैं जस्ट टू सपोर्ट द स्पाइन. व्हाट इज हैपनिंग अगेन इज, जस्ट जब भी कमर पीछे जाएगी, अगर आप बल्जिंग ऑफ डिस्क की इमेज याद रखें, तो सेम वही चीज होगा, जो एकदम से स्पाइनल डिस्क पे प्रेशर पड़ेगा और डिस्क बल्ज होगा. सो बोथ बेंडिंग फॉरवर्ड्स एंड एक्सटेंडिंग बैकवर्ड्स हैज टू बी अवॉइडेड व्हाइल क्लाइंबिंग अप द स्टेयर्स एंड व्हाइल डिसेंडिंग डाउन द स्टेयर्स. How do we take care of our back? Again, I am repeating the body mechanics. Do remember this word. Mechanics means the motion. हम जिस तरीके से उठ रहे हैं, जिस तरीके से बैठ रहे हैं, जिस तरीके से हम सो रहे हैं, या किचन वर्क है, ऑफिस वर्क है, या वी आर ट्रैवलिंग, it has to be very, very appropriate. The mechanics, whenever the body is in motion, it has to be in appropriate posture so that it doesn't put undue stress on your spine. मेन कॉमन जो हमारे पास मैक्सिमम ओपीडी में पेशेंट्स आते हैं, बाल्टी उठा रहे थे, एकदम से कमर में झटका लग गया, चढ़क पड़ गया. लॉट ऑफ लोकल डायलेक्ट वर्ड्स टर्म्स आर यूज्ड. व्हाट इज हैपनिंग अगेन? The improper technique of lifting an object. Mind it, even 100 grams of an object, if you are picking up from the ground and your posture is incorrect or your spinal motion is incorrect, the moment you pick it up and move upwards, even the 100 or even the 50 gram of an object, it's not the mass of an object, it's the inappropriate way of picking up the object which puts stress on the spine. This we'll discuss later. Maintain safe postures, and this goes especially for the students and the office worker people. The students, they are continuously sitting, maybe the schools, colleges, universities, you have to maintain an appropriate posture. बल्कि अगर आप अभी भी मुझे सुन रहे हैं, टाइम अभी सही है, you can correct your posture. Sit straight, head straight, shoulder straight, spine straight, legs, hip and knees maintained in 90-degree position. And always maintain one thing, your arms and shoulders should not be lifted up or downwards, sagging downwards. मेन चीज जिसके पास लोगों के आज टाइम नहीं है आजकल, कीप योरसेल्फ फिजिकली फिट. एक एक घंटा you can scroll your social media, Insta, but you won't have 10 minutes to keep yourself physically fit. That is the biggest dilemma of the youth. And it is not only the youth, even you can see the people 60 and above, those who are very active throughout their lifestyle. Now, just because of this beautiful Android phones in their hands, they are physically unfit. Stretching and exercise. This is the major factor which is aggravating, and you can take care of your back. Always, अगर आप कोई exercises initiate भी करते लोग, what I have seen is, मैं तो रोज सुबह वॉक करता हूँ, मैं 1 घंटा चलता हूँ, 4 बजे उठ जाता हूँ, 5 बजे इवनिंग वॉक, ट्रेडमिल, whatever. But what they never say, what they never tell, and what they never practice is, whenever you initiate walk, maybe it's a 1 kilometer, 2 kilometer, 3, do you stretch your muscles? आप रात भर एक मसल एक पोजीशन में रहा, सुबह यू फ्रेशन अप योरसेल्फ, ड्रेस्ड अप, एक बढ़िया सा जिम सूट डाल लिया, ट्रैक सूट डाल लिया, एंड यू स्टार्ट वॉकिंग विद योर heavy sports gears. But do you really stretch and do certain exercises, a warm up exercises before initiating a walk? Mind it, if you stretch the muscles, if they are in spasm because of the night cycle, they will be coming back to their original position. Exercising will increase the vasodilatation, blood circulation बढ़ाएगा, oxygenation बढ़ाएगा, and your body is ready to take up the load of your walk, maybe 1 kilometer, 2 kilometer. I have got a patients who walk for 10 kilometers, 5 kilometer आना, 5 kilometer जाना, still having back pains. What? They don't go for stretching, no exercises. So, if you want to take care of your back, go for stretching and exercises whenever you initiate any walk, or not only if walk, maybe if you are going to the office, maybe you are home workers, do stretch and exercise. The best part, which everyone is always suffering from and always making an excuse, stress. लेट मी टेल यू वन थिंग, इस पृथ्वी पे अगर चींटी भी है उसको भी बहुत स्ट्रेस है। आज धूप बहुत हो गई, बारिश बहुत हो गई, खाना मिलेगा कि नहीं मिलेगा, बट स्टिल शी फाइट्स आउट, शी कम्स आउट फ्रॉम हर हाउस एंड शी वर्क्स। सो नो नीड टू टेक स्ट्रेस, just enjoy, keep yourself good, think good, and everything will be good. And nutrition, you will be surprised to see this point. Yes, a healthy diet is very important for the healthy muscle joint growth. And this we can discuss a lot and go in details, but no need. But healthy nutrition, avoid excess of fried food, fast food, and the spicy food if you want to keep yourself healthy, because anything, because of the food, maybe you are having any gastric irritation, maybe any other systemic illnesses, that is going to affect the spine, because you will be laying on the bed, you will be laying unnecessarily on the chairs, putting extra load on the spine. So be careful with the nutrition. सी, अभी हम बॉडी लिफ्टिंग मैकेनिक्स की बात कर रहे थे, दिस इज ऑल मैकेनिक्स। अब हमें कोई भी हैवी ऑब्जेक्ट उठाना है, देर आर डेफिनेटली हाउस होल्ड लेडीज, आपने होम मेकर्स को देखा होगा, जो स्टूडेंट्स उन्होंने अपनी मदर्स को आज सोफा हटा रहे थे, आज घर में शिफ्टिंग की, बैक पेन हो गया। रीजन बिकॉज इज ऑब्जेक्ट हैवी था, उसको उठाने का तरीका गलत है। दिस इज नाउ वी हैव टू टेक केयर ऑफ द बैक। ठीक है, जब भी हमने कोई भी हैवी वेट उठाना है, कीप द लोड क्लोज टू द बॉडी, एंड इफ द वेट इज टू हैवी, ऑलवेज डू कुछ ना कुछ एब्डोमिनल ब्रेसिंग यूज की जाए, सो दैट द स्पाइन पे लोड कम पड़े। ठीक है, पाइवट द फीट एंड अवॉइड द ट्विस्टिंग, कहने का मतलब कीप द सम स्पेसेस बिटवीन द टू लेग्स। और जब कुछ ऑब्जेक्ट उठा रहे हैं, रोटेट नहीं करना, दैट्स रोटेशन, स्पाइनल रोटेशन इज गोइंग टू पुट एक्स्ट्रा प्रेशर, द कंप्रेसिव फोर्सेस ओवर योर डिस्क। फाइन, सो पाइवेट नहीं करना है, बॉडी के नजदीक को रखना ऑब्जेक्ट, एब्डोमिनल ब्रेसिंग करनी है, एंड देन लिफ्ट द हैवी ऑब्जेक्ट। एंड द मोस्ट इंपॉर्टेंट पॉइंट which everyone should focus on, wherever you are, whether you are at house, whether you are in school, college, university, offices, teamwork is the best work. कोई भी ऑब्जेक्ट अगर उठाना है, पहलवानी दिखाने की कोई जरूरत नहीं। डोंट बिकम अ बॉडी बिल्डर फॉर अ 10 or 20 seconds and be a patient for lifetime. It's better, you should have a good team, ask help from the people, कोई बुरा नहीं मानेगा। Now, this is especially for the ladies, the house homemakers, not only ladies but everyone in general. If you're working in the kitchen, bar objects ऊपर नीचे उठाने पड़ते हैं, it's very clearly saying the best zone for lifting is between your shoulders. The object का जो circumference होना चाहिए वो आपके shoulder length apart होना चाहिए, and your waist. Fine. Or heavy objects, if it is a kitchen or even in the offices, you are having a lot of piles of files, you have a lot of other, if I talk about the industries where you have to lift heavy objects, so keep the heavy object above on the shelves only at the waist level, कमर के लेवल पे उसको रखना है, ताकि उठाने में और वापस रखने में कोई दिक्कत ना हो। और जितने भी हमारे लाइटर ऑब्जेक्ट्स हैं, इन बोथ गोस फॉर किचन इंडस्ट्रीज एंड ऑल, लाइटर ऑब्जेक्ट्स ऑन द लोअर और हायर शेल्फ में होना चाहिए, ताकि आपको दिक्कत ना आए। Now, proper lifting techniques. Again, I'm just brushing it off. That is, wide base of support चाहिए, shoulder width apart होना चाहिए पैर, कमर हमारी सीधी रहे, head and shoulders up. कभी भी सीधे नहीं झुकना है। मैंने कहा 10 ग्राम की भी चीज हो, प्रॉब्लम हो जाएगा। Just bend on your hip and knees, कमर घुटने के बल नीचे जाइए, and slowly get up and pick up the object. And you can tighten up your stomach muscles. ठीक है, जस्ट सक इन, हवा सांस अंदर की तरफ खींचे, हिप एंड मसल्स को यूज करना है, एंड जैसे ही सामान उठा लिया, जस्ट ब्रीद आउट एंड फील रिलैक्स्ड। नाउ यू आर द आर्नोल्ड ऑफ योर होम। एनी क्वेरीज टू एनीवन? द कमेंट सेक्शन विल बी ओपन where you can ask the questions after this session, and feel free for the question answer sessions. ये स्लाइड बहुत इंपॉर्टेंट स्लाइड है आजकल के यूथ के लिए। अगर आप खाना खाना है तो बर्तन तो धोने पड़ेंगे, एंड न्यूक्लियर फैमिलीज है, आइदर यू आर स्टेइंग सिंगल और यू आर मिंगल्ड, fortunately, unfortunately, you need to wash the dishes now. And why the male specifically? Good morning call for all the males, since you never had an habit, but still, unfortunately, you have to be the kitchen king. So wash basins and should be at the waist level. It should not be down so that you need to bend while washing the utensils. It should not be above the level of waist, so that will put undue stress over your shoulders. So keep this thing care of. जो आपका किचन का शेल्फ लेवल है और आपका जो वॉश बेसिन है, it should be at the waist level so that you don't have to bend while doing the kitchen activities. कैरिंग एंड लोडिंग द ग्रोसरीज. बहुत लोग 5-5 किलो, आज घर में पार्टी है, लॉट ऑफ पीपल दे आर कमिंग, यू जस्ट इमीडिएटली हैंग आउट एंड यू जस्ट पिक अप लॉट ऑफ ग्रोसरीज. शॉपिंग में जाना, लॉट ऑफ that's become a prestige issue until and unless you carry out 5 or 10 branded bags with you. It's good if you're shopping, but do take care. Picking up and carrying kids, most important for the young mothers, newly mothers. Whenever you are picking up and carrying the kid, carry him towards the lateral side of the body, either out or in the front side of the body, but again at the chest level, so that while feeding also you don't have to bend forward. Fine. Walking with the dog, again a prestige issue. Big dogs, you have lot of terrier breeds along with you, and those terrier breeds, when you are strolling them with them, you're walking with them, and they start pulling you. And one jerk is sufficient enough to break or put strain or sprain the ligaments and the muscles of the spine. So do take care while walking with the dogs. And when you are having the bulky breeds, take care. One jerk is sufficient to see a physiotherapist. शौक है gardening, sweeping. Again, whenever you have a kitchen garden or you're working, or you're a farmer working on the fields, again I'm saying don't bend your spine, directly go on the hip and knee and then do your activities. Do enjoy the gardening, enjoy the sweeping, no issues, but your sweep, it should be long enough so that the spine is not bended. Mind it, today we are just talking about how to prevent our low back. Driving, lot of patients they come to us, longer drive, 8 घंटे 10 घंटे, night drive, morning drive, back pain. Again, this is very important aspect, and I hope so mobile industry, this automobile industry, they do take care, but we never bother. Long hour drives, the steering, why this is there, which we ignore and which not a doctor also will tell you, suggest you, and sometimes a physiotherapist also forgets that the seat level and the steering level should be such so that we don't have to bend forward, and it should not be inclined also so that it is producing the extra load on the spine. Because if you're bending forwards or you're inclining behind, it puts extra load on our disc, leading to the strain in the hamstring tightness. Then it is leading to decreased circulation. Okay, increase pain along the lateral side of the knee. If the longer journey is there, the seat level should be sufficient, so that try to maintain the knee at 90-degree angles, because while using the clutch and the gear, it doesn't put undue stress over your knee. And all these things, when they are there, definitely जब lower back जा रही तो upper क्यों पीछे रहे? It was our neck muscles and commonly the trapezius, the scalenes, they get affected. And because of this stress at the cervical region, undue pressure is loaded over the thoracic and the lumbar region, and it again causes the low back ache. So, और एक और चीज, when you have to drive more than 1 hour, and it is for the all the males, never keep wallets in their pockets, because if it is a longer drive, it can cause compression to the nerves. So keep your wallets outside from the pockets and enjoy the journey. Sleeping posture, most important. And कोविड टाइम से हमारा यूथ, हम लोग काफी अफेक्टेड हैं, बिकॉज 2 साल वी वर एट होम, वर्क फ्रॉम होम, लर्निंग फ्रॉम होम, टीचिंग फ्रॉम होम, एजुकेशन फ्रॉम एवरीथिंग फ्रॉम होम, और जो सबसे ज्यादा चीज हमारी अफेक्ट हुई वाज द स्लीपिंग. हम दिन में भी अगर कोई ऑनलाइन सेशन, क्या पता मेरा सेशन कोई अभी सुन रहा हो, क्या पता लेटा ही हो, or be a very unawkward position में. We need to maintain the neck, shoulder, wrist, knee and hip posture, because if all this upper extremity and upper half is maintained, your back is aligned. Don't forget, we need to maintain the two lordotic curve, the S-shaped spine. For that, the mattress and the sleeping posture should be correct so that those curves are not aggravated. This is all about the sports loving people, those who have habit. बहुत से it's not only the players or the students, a lot of staff people also, they are involved in some or the other activities. Never forget, when you are growing in the age, first thing is maintain the muscle strength and the stability. Why I'm using this word stability, it is very important to maintain the balance. Flexibility, again, do stretch before and after the game. And endurance, what is endurance? Endurance होता है number of repetitions per unit time, मतलब आप एक एक्टिविटी कितनी देर तक कर सकते हैं. सो यू नीड टू फर्स्ट बिल्ड अप द एंड्योरेंस, ताकि आप ज्यादा देर तक, अगर आप बैडमिंटन खेल रहे हैं, आप वॉलीबॉल खेल रहे हैं, कबड्डी खेल रहे हैं, कैरम खेल, वट एवर यू आर प्लेइंग, आप उस पोजीशन को और उस एक्टिविटी को ज्यादा लंबे टाइम तक सस्टेन कर पाए. और जब भी रिकवरी करनी है, फॉलो द एनारोबिक फेज. आई होप सो आई एम क्लियर टिल नाउ. मोस्ट इंपॉर्टेंट एरोबिक एक्सरसाइजेस बहुत जरूरी है, 20 to 30 मिनट्स पर डे. ना सिर्फ आपकी स्पाइन बचेगी, वेट मैनेज होगा, एंड्योरेंस इंक्रीज करेगा, आपका ऑफिस में वर्किंग आवर बढ़ेगा, रिकवरी टाइम आपका, बाई चांस कोई इंजरी हो गई या स्प्रेन हो गया, रिकवरी टाइम हमारे पास अच्छा होगा, और सस्टेन परफॉर्मेंस हमारी बढ़ती जाएगी. और लास्टली, मोस्ट इंपॉर्टेंट, इफ यू आर फिजिकली फिट, एरोबिक एक्सरसाइजेस कर रहे हैं, यू आर अ स्ट्रेस फ्री पर्सन. अदर बेनिफिट्स, और अगर ये सारी चीजें, सिस्टमिक चीजें हैं, आपका ब्लड प्रेशर डिक्रीज, कोलेस्ट्रॉल हो जाएगा, इंक्रीज हार्ट फंक्शन, डिक्रीज फैट, और इंक्रीज एरोबिक कैपेसिटी, these all things where what will happen will lead to less of anxiety, tension and depression. And definitely, if none of these things are there, your spine is happy spine. This is the most important slide for me for an entire presentation. This, just imagine, or आज when I end up the session, I think you can promise to yourself, हमारे पूरे दिन में 24 घंटे होते हैं. We have 24 hours, and if you see, we have 1440 minutes. Daily we have 365 days, and you multiply it with by 365. इतने minutes हमारी life में रोज हैं. Can't we take out 30 minutes for ourselves? I'm repeating, 24 hours हैं, उसमें 1440 minutes हैं. और जो स्पेशली आई एम टॉकिंग अबाउट दोज पीपल, फॉर दोज पीपल जो कहते हैं टाइम नहीं है, 1440 मिनट, कांट यू स्पेयर 30 मिनट्स फॉर योरसेल्फ? और इफ यू कांट, डेफिनेटली वी फिजियोथेरेपिस्ट आर देयर फॉर योर हेल्प. डोंट वरी, आपका सारा टाइम हम ओपीडी में लगा देंगे. नाउ, जो मैंने शुरू में कहा था और आपसे रिक्वेस्ट किया था, मोस्ट इंपॉर्टेंट थिंग इज maintain the strength and the flexibility. बार बार ये word use हो रहा था, strength and flexibility. Now these are the muscles which we need to strengthen and we need to flex. इसकी हमें stretching करनी है. Trunk muscles, most importantly abdominals, and forget आपका 4-pack, 6-pack, 8-pack. Focus, your abdominal muscles should be strong enough, because if your muscles, abdominal muscles are strong, it will lead to reduced intradiscal pressure. रिड्यूस इंट्राडिस्कल प्रेशर का मतलब है डिस्क पे प्रेशर कम पड़ेगा, एंड विल इंक्रीज द इंट्रा एब्डोमिनल प्रेशर. फाइन, इसका मतलब हमारी स्पाइन स्ट्रेट रहेगी, कॉमनली अपने नॉर्मल कर्वेचर पे. एक्सटेंसर्स, ये वो मसल्स हैं जो हमारी बैक में लगे हैं, ये इनको स्ट्रेंथन करना है. हम कोई भी एक्टिविटी कर रहे हैं, कोई चीज उठा रहे हैं, तब भी एक्सटेंसर्स का काम है. नीचे सीढ़ियां उतर, एक्सटेंसर का काम है. बैठे हैं, तब भी एक्सटेंसर का काम है. अगर एक्सटेंसर मसल्स हमारे स्ट्रांग होंगे तो लो बैक हमारी बची रहेगी. ये वो 3 मसल्स हैं. वैसे other muscles are also there, but the quadriceps, why I have taken these muscles, you are all aware, the quadriceps, the glutes, जिस पे आप बैठे हैं, खड़े हैं, and the hip flexors, इनकी स्ट्रेचिंग बहुत जरूरी है, especially morning walkers, जिनकी long hour sitting है, long hour standing है. You need to focus on the stretching of these 3 muscles. These are few stability exercises. हमने बात की स्ट्रेंथ की, हमने बात की फ्लेक्सिबिलिटी की, स्टेबिलिटी। स्टेबिलिटी क्या, जब हम कहते हैं कोई चीज उठानी है, हैवी ऑब्जेक्ट है, टर्न कर रहे हैं, बार बार हम कह रहे थे कि टर्न नहीं करना, यू नीड टू बी स्टेबल। तो यू शुड गो फॉर एब्डोमिनल क्रंचेस। And first, when you start up with the crunches, it should be under supervision of an expert, maybe physical trainer, maybe fitness trainer, maybe a physiotherapist. He will tell you the appropriate, and it is not mandatory to have the complete crunches. Crunches will be planned according to your BMI, according to your need for the body. Press ups or the push ups, and this is the bird dog position. If you can sustain this position, that is one leg extended, one hip extended, and the opposite arm extended. And the main thing is, for obtaining this position, the main target is the whole time. You need to hold time. The more the whole time, more the strengthen the body is. और इसका सबसे बड़ा फायदा क्या हो रहा है? If you see the trunk muscles get balanced, and you attain the stability. जो हम शुरू से बात कर रहे थे, these are the certain stretching exercises. Swiss ball, lower trunk rotation, which you can see on the slide, hamstring stretch, which you can see this guy is performing, and the quadricep stretch. And the most important thing is, now I have worked with the NCR people, the corporate sector people. You'll all be surprised that in corporate sectors nowadays, or in BPOs also, they don't have chairs. They're all the employees, they are sitting on the Swiss ball. And if you can sit on a Swiss ball, that means you achieved strength, you achieved stability, you achieved flexibility. So target should be sitting on the Swiss ball for the longer period of time. Any questions? The comment box will be open, and you can ask if there is any query, any suggestions, or anything you want to describe here in the for this presentation. Now, I hope so. I I was able to justify this session, and thank you for listening. So, and for you all being the good audience, have a good day. And I think I could justify that you need to take care of your back. The thing is, if you take care of your back, you you are able to stop all other basic problems coming to your lifestyle. Maintain the body mass index, maintain the strength, and you'll be a happy person. Otherwise, come to us. The physiotherapists are going to welcome you. Thank you for being a good audience. Thank you for the sessions.